let's go ahead and get started. I'm going to introduce our presenters today. We do have two joining. So Lori McKee is from Eide. She's a healthcare manager in the consulting field of our healthcare department. Lori has been in the healthcare experience for more than 35 years, including 20 years of leadership experience. Lori has worked as a licensed registered nurse for 31 years with clinical experience in emergency, surgical, medical, cath lab, and intensive care unit. She's also experienced with information technology with ERM development and clinical integration. Thank you, Lori, for hosting today. Joining us from Legato Healthcare Marketing is our friend Mike Milligan, and he is the president of the company and the owner. Mike is actively engaged in identifying solutions to address the unique challenges specific to rural hospitals, specifically clinics and medical technology companies. So we're happy to have Mike join us today in this joint presentation with Eide Bailey. We're going to go ahead and turn it over to our presenters now. And Lori and Mike, get started.
Yeah, great. Well, thanks for joining us today. We're excited to have you here. I know everybody's challenged with how, with your surgical volumes and your surgical departments and how we're going to be reopening. So these are some of the topics we're going to talk about today. First of all, forecasting our case volumes in response to COVID-19 pandemic. CMS, the U.S. Surgeon General, and others have recommended canceling our elective and our non-essential cases. So now that things are opening up, we need to predict that case volume and all that volume that we're going to be able to recoup. So planning is going to be key to our success, and there's a lot of multiple factors that we need to consider as we plan to reopen. And our readiness and our plans to resume elective procedures may vary by your geographical location and your COVID activity.
I think as Lori is discussing certainly the operational parts and what we need to do from a quality perspective and operations perspective, what I'll also be talking about is what we need to do in terms of then really helping patients feel comfortable in many ways, because there's a lot of apprehension in terms of really wanting to receive those services. In other words, we may be ready, but we want to make sure they're ready as well. And then from there, talking about a little bit about how to move from that message to having more of a data-driven strategy overall, which is, in short, how we actually formed a partnership with Eide Bailey, because they've helped us quite a bit in terms of kind of the upfront work and the research that we do when we come in to help a rural healthcare organization in particular with their marketing efforts.
So let's start with forecasting that case volume. And where do we begin? So we begin with that case backlog, and it's quite a feat and takes a lot of work to really evaluate all those previously canceled and postponed cases, going through our schedules and really looking at all of those cases. And it may require contacting patients, contacting providers, so that we can understand what cases can we reschedule and what can we put on our future plans. So as we contact our patients and talk to them about their plans and where they're at, maybe they've completed their cases elsewhere. They may have felt that it was a little bit more urgent than we did, and they were able to have it completed at another facility. So they don't need it. We don't need to have that on our backlog list. Patients may be electing to postpone for multiple reasons. Perhaps they lost their job due to the COVID pandemic, so they no longer are employed, so they don't have the financial ability to have their elective procedures done right now. Maybe their insurance, they no longer have insurance, or their insurance coverage has changed, so that's affected their decisions to have elective surgeries done. Perhaps they were furloughed during the pandemic and now they're just getting back to work, so they really aren't in a position to be taking time off of work to have elective procedures done. And as we think about these things and what our patients are doing, and we're talking to our patients, another thing that we're going to need to be thinking about as organizations is, how are we going to handle these out-of-pocket expenses and provide financial counseling to our patients? Another thing that we need to also be considering is, patients may just not want to be coming to our facilities because of that risk of exposure. And so they are just going to just put it off for now as well.
Or because of their perceived risk of exposure, right?
Exactly. Thank you for that. Yes. We're pulling together that backlog of cases, but we also need to also be including our usual caseload in those new cases so that we're getting a realistic picture of what is our volume going to look like. And it's not going to be an easy feat for us to do this. It's going to require some work and some time to pull this all together. Planning, as I mentioned, is going to be really key to the success of opening up our surgery centers and adding on our elective cases. And it's going to be key to really engage all of our stakeholders. And when we talk about all the stakeholders that we need to bring together to start talking about planning and opening up our elective surgeries, we need to not just include our surgeons and our surgery departments, but we need to talk about administration, our leaders, key leaders who are decision makers, our schedulers. We need to include finance because we need to talk about those. How are we going to handle those out-of-pocket expenses, and our financial counseling, and then nursing. So there's a lot of people that need to be at the table when we start these planning discussions. And the first thing that we're going to talk about is case prioritization. So when we talk about prioritizing cases, it needs to be a standardized process so that everybody's on the same page and everybody understands how we're going to prioritize our cases. And that's why all those stakeholders need to be at the table so that we don't have any disagreements or frustration. It's a really systematic, standardized process. So the first and foremost is patient's health. So if your patient's health is going to be compromised or deteriorate because of a case is postponed, they should be at the top of the list for prioritizing their case to be scheduled. Specialties, maybe if you have orthopedics, neurology, cardiology, any of those specialties, they may take some priority over others. Your backlogged volume, what is the number of the case volume that you're looking at, and case volume by specialty as well, and complexity. What is the case complexity so that you're understanding how long those cases are going to take. Capacity, we're going to talk a lot about capacity even more as we talk more into the presentation. PPE supply adequacy. Are you going to have enough PPE to cover the volume of cases that you need to do? And equipment and supply availability as well. And some other things that I don't have listed here that we also maybe want to consider is that payer and return on investment, and really surgeon relationships. You really, if you have, your main providers that really bring a lot of revenue to your facilities, it's something that you want to take into consideration as you're prioritizing your cases as well. So then when we talk about scheduling, there's that capacity word again. And we really need to think about capacity because you're going to feel that temporary surge as we're trying to schedule all of these backlogged cases into our schedule. And so look at some temporary surge locations that perhaps you have. Do you have unused OR suites that you're not currently using? Is there any place in your PACU, your ICU? What places could we use for procedure rooms, for temporary locations that we could use for surge capacity right now as we are looking at adding on these extra cases for a temporary period of time? We may need to look at the block schedule. Do you have certain surgeons that have a much higher backlog of cases than others, so that block schedule needs to be adjusted on a temporary basis, which is another reason why all of these stakeholders need to be at the table as we are planning for these cases. Do we need to extend hours temporarily, changing our hours of operations for a period of time, or adding on Saturday schedules for a period of time until we're caught up? But as we do that, we really need to be cognizant of our staff and our staff needs right now. Staff are going to be in different places. Some may be looking for extra hours if perhaps their hours were decreased and they were struggling not getting their normal hours during the pandemic. They may be more than happy to pick up extra hours or work weekends for a period of time. But others, if they were displaced or perhaps required to work extra hours during the pandemic, it may be the opposite. They may just be wanting to get back to normal and work their normal hours of operation. And other things to consider with staff is I know school's out now, but many have children at home because of daycare issues or different family situations. So we really need to be supportive of our staff and provide support of our staff and be thinking about that and include them in our conversations as we're planning to add on our elective cases. And then also as we schedule, think about what our case times will be. You know, there's a lot of new infection control practices now that need to be put in place. We're talking about adding 30 minutes to turnover time because of new intubation and extubation guidelines. So what is that going to look like, and how is that going to affect our case times to add on to our scheduling? For pre-admission testing, this again is going to take some time for those backlogged cases, reviewing all of what was previously done, what needs to be repeated. Is the H&P still current? Is the diagnostic testing still current? What needs to be repeated? We want to be very careful we're not repeating testing that's not indicated. And then doing the COVID risk assessments. The ASA is recommending that all patients need to be screened before they even present to the hospital. What can we be doing through telehealth and really taking advantage of telehealth and telemedicine, and how can we utilize that to accomplish a lot of these things without bringing those patients in, putting them at risk, and those types of things. And we're also getting recommendations that patients not reporting symptoms should still have testing prior to undergoing their non-emergent surgery. And then reviewing the prior authorization, making sure that that's completed. If it was completed, is it still current, or do we need to go back and make sure that we don't need to do any updating or anything like that? Making sure our vendors, if they were contacted, are they contacted? Are we going to make sure that we have all the equipment that we need, any implants, things like that? They're available. They can still be there. We're going to have that. And really planning during our pre-admission time for post-operative needs more than ever now with physical therapy, home health. What follow-up is the patient going to need post-operatively, so that those organizations, those entities can start planning, because everything is taking more time now, and this pre-screening that needs to be done, things like that, so that they can be putting things into place to address post-operative needs as well.
Just to add a comment to that, Lori, as we look at, telehealth in particular, obviously a lot of people, a lot of organizations have come to rely on it for, treatment around COVID, but the silver lining, I guess you could say, is that in some ways, in particular in rural health, I think has been maybe a little behind the curve in terms of traditionally in terms of using telehealth for primary care. And I think now we're seeing that more and more organizations are actually picking that up and not just looking at it as a short-term solution, but how can we make that and how can we integrate that into our practice long-term? And I think as we look at even how reimbursement has been happening around COVID, that long-term, I think the general consensus is that we're not going to go back to necessarily the old reimbursement rates, but that there's going to be more of an environment to use telehealth in the long term.
Right. Thanks.
Mm-hmm.
And then looking at our registration process, we're going to need to be doing the COVID testing and screening, as I mentioned. And how are we going to accomplish that? Can some of this registration process be done virtual? I've seen or heard of a lot of facilities doing things, really thinking out of the box in curbside registration. And who are we going to allow to accompany the patient? Are we going to allow anybody, or is it just going to be curbside drop off and pick up? And a lot of this is going to, again, depend upon your geographic location and the COVID activity within your area. So these are things that you're going to need to be considering, but we need to have efficient processes to ensure patient and staff safety both. But should the screening be curbside and then we do testing at entrance? But all those things are going to need to be part of your policies and procedures as we think about the registration process. Then we get into our intraoperative, and I've mentioned some of these things just briefly, but the guidelines for intubation and extubation, and the time to enter the room after an intubation from the ASA, the American Society of Anesthesiologists, and this is based on your type of PPE and your air exchanges. So the CDC, has had guidelines and table out there for your operating room based on typical 15 air exchanges per hour. On a 15 air exchange per hour in your operating room suite, 99% of airborne pathogens are removed in 18 minutes, 99.9% in 28 minutes. So this is what they're basing in this scenario. Any unnecessary staff could be allowed then to re-enter the room wearing a surgical mask. So that's where we're coming up with adding this time to the turnover time following intubation, and the same applies to extubation. So this is for non-aerosol generating surgical procedures. So they're recommending anesthesia and perhaps the circulator remain in the room during intubation and extubation, allowing that air exchange, that time for the air exchange for staff safety. Now with N95 masks for those aerosol generating procedures, which would include intubation and extubation, then they would be allowed to stay in the room during those types of procedures. But we typically don't wear N95 masks for all of our surgical procedures, and I don't think we want to. So we need to be thinking about those things. So I talked a little bit there about the PPE guidelines, and so the ASA is recommending the N95 mask for the aerosol generating procedures, and we also need to then be thinking about non-essential personnel that should be allowed during our procedures. And that's a tough one because learning is so important in healthcare, and we know that. But maybe right now is the time that we start thinking about nursing students and things like that, that perhaps now is not the time to, or it's time to really evaluate who should be allowed in the OR suite during some of our procedures. So I've talked about a lot of these, but I think it's worth, let's just walk through all of these. Some of them are new, some of them I've covered. But when we talk about all these infection control practices, the COVID screening of staff and visitors upon entering the facility. So staff as well as our visitors, we need to have our policies for patient testing. What do we do then? How do we respond if a patient is positive? Maybe they weren't exhibiting any symptoms, but their testing comes back positive. Then what's our response? Well, what are staff to do? Or perhaps a patient's under investigation. Well, what's the staff to do? What's the indication for staff testing? They are recommending that employees in perioperative areas should be tested at least once a week. So what's your policy going to be at your facility? So we need to think about that as well. The PPE guidelines for procedures, but not only just for procedures, but also what is it for turnover and for cleaning of equipment for your sterile processing areas, and really monitoring appropriate use of your PPE and identifying misuse. We need to really avoid waste of our PPE right now. So if you're identifying misuse and inappropriate use of PPE, it's time to provide education to staff so that we can identify that and we can address it and avoid that waste. And then what are we going to do if our PPE level falls below threshold and we aren't going to have enough PPE to manage the volume of cases that we have scheduled? Are we going to cancel cases? Or, what is the plan then if we don't have enough PPE to perform all of the cases that we have scheduled? And then waiting room practices. First of all, are you going to open your waiting rooms and allow visitors? When is the right time to do that? You need to, first of all, determine when is it the time for us to allow visitors? When is it time for us to open up our waiting room? How do we allow seating to make sure that we're providing social distancing? And then cleaning between families. How are you going to accomplish adequate cleaning between families and things like that? So these are all very important things that we need to consider as we're planning on adding on our elective surgeries. So we've come to polling question number 2, and this is really individual for your facilities, but we want to know, what is your number one concern about reopening now for elective surgeries? Number 1, you're not prepared in terms of proper precautions in COVID protocol. Your patients are uncertain about whether the environment is safe. You're not equipped to handle the bottleneck of new procedures. Referral sources are not confident yet in sending patients, or your clinical staff is reluctant to accept new patients.
Okay, so our number 1 is our patients are uncertain about whether the environment is safe. Okay, well that
Good, that leads right into mine.
That does. Okay. So, what Lori and I are ultimately, what we're talking about here, of course, is, yes, we're being conscious about what we're doing, what we have been doing, and as we're still dealing with COVID issues, what we're doing as an organization. And as Lori has said, that varies depending on what part of the country you're in terms of what level, where you are and all of that. But with that, just as leaders in our organizations, we're certainly always attuned and thinking about how we're protecting our patients, quality of care, those important aspects. But we also are looking at the business of healthcare as well. And so that's partly what we're talking about here, is how, as leaders, are we also rebuilding the financial situation in our companies, in our organizations, in our rural healthcare organizations. And certainly we have to address all of the different operational concerns that Lori addressed, but then moving forward, we have to say, okay, how do we build from that? How do we build upon that? And as we'll talk about here in a moment, as we would expect, there is some anxiety, no question about it. There should be, right? And so, and sometimes even, within, and I added on to what Lori had said before about, the difference between if people perceive a hospital to be safe or whether or not it is, and we know as providers that actually it's really one of the safer places you can be in terms of what our protocol is and those types of things, but the average person maybe has different perceptions of that. So our role is to look and say, how as leaders can we restore that trust and that security that they have of coming to our organization. And so overall, what we're talking about here is how to calm the waters. We're going to kind of transition a little bit to, as we look at sort of some of the short-term aspects, is what do we do kind of more long-term in terms of building market share. And that comes with, prioritizing service lines and really smoothly transitioning to the next area of business in terms of bringing up those surgery volumes. So we talked about, when will patients feel comfortable returning? And certainly that is near and dear to what's on all of your minds, because I think it was 67% or whatever had said that this was kind of the feeling that you have. And it certainly is one that we're hearing in the rural healthcare organizations in particular we work with around the country, that is a very, very common thing. And so what those organizations are doing is saying, yes, we have to jump in. We need to start getting the surgery suite busy. Certainly we know short term there's going to be maybe a little bit of a, more of a demand, but yet at what point and when are people going to feel really comfortable in coming back? This particular survey, and actually it's in this day and age of COVID, it's 2 weeks old, 3 weeks old. So it's, I'd like to kind of do this data again, but in general, this was a study done by a national healthcare management firm. And it was nationally among different demographics around the country. And at that time, 50% said that they might reschedule earlier if they receive some kind of prompting from a provider. So that prompting we interpret to be giving some messages of reassurance, but it's also really educating people. It's about how do we help them understand what we are doing, what precautions we are taking, just helping them feel more comfortable about that. And we'll talk about some ideas of how to do that here in just a little bit. And of those respondents, 38% said that safety of the care site or risk exposure would be a consideration for them to reschedule. So your thoughts are right on board. In fact, I look at that 38% and I'm surprised that it's not higher actually. So, okay, so we kind of talked about, restoring this trust. So it's not that your organizations weren't trustworthy. Again, we kind of look at it more as almost a confidence type of thing as well. How can you build that with them, and how can you make them feel comfortable coming to your organization? And certainly there are various messages regarding even how they shouldn't even avoid delay of necessary care, helping them understand that. I mean, just because we've had COVID doesn't mean that we still don't need proper primary care and preventative medicine, as we know. And there are a lot of people who are needing care that should have received care already, but just haven't been able to. We have to get them back on track in terms of living, healthy lifestyles. And then, there's a general theme here in terms of what we call welcome back, which is, again, an approach of really trying to communicate with people that it's time to come back, it's time to restore their health. So before we go on to that, I want to kind of get a pulse here again. We have a polling question number 3. And the question is, which statement best describes the perception in your community about scheduling elective procedures? And the answers are, I'm ready to reschedule my procedure, or I'm more comfortable waiting for a few weeks before scheduling my procedure, or 3, I don't know what they're doing to protect us. Number 4, I don't think it's safe. And number 5, it's irresponsible and too early to schedule appointments yet. I'm more comfortable waiting for a few months before scheduling my procedure. But yet we had 29% that said I'm ready to reschedule. We'll look at the silver lining, right? So, but those are both very important. They really show the psyche of our community. And again, different responses from different parts of the country. So how do we start building that confidence? So first, I would say, and this comes into play in whether or not it's, what we're doing post-COVID or what we're doing generally as we market and we communicate with our audiences. And that is internally first. This is so much even more important in this venue of where we have, overworked and overstressed healthcare providers, and helping them understand how we're bringing patients back and helping them understand the why and the process. In particular, as we're looking at rural communities, we very much know that our own employees are really the ambassadors of our message. They are the ones who are, assuming, we're following safe distancing, they're the ones that are in the grocery stores, or maybe that we're going to reconvene and go to our churches, and as things open up, go to soccer games and those types of things. But we see those people that work for our organizations are the messengers of our message in our communities. And so it just is so important that those staff are understanding, comfortable with what we're doing as an organization. They're going to be the ones that are communicating that level of comfort and that level of reassurance. And that's frankly more important than any advertising you can do, anything like that. It's that type of relationship. And of course, with various providers and such as well, is in that same category. And then we have existing patients. So again, some of the things that Lori started to talk about here today already, but just in terms of what our protocol is in terms of rescheduling surgeries. But we should use that process, and there's many ways to do that as we're rescheduling, to use at the same time as to educate our patients on what to expect. There are various things that you could do, from even just having certain things that are part of the script when something's being scheduled, to just offering some reassurance and here's what to expect and what questions do you have, and having the staff on the phone that's very prepared and has a reassuring tone in the way that they answer those questions to give that level of confidence. And then depending on what your protocol is in your organization, if it's email follow-up to, or it's a messaging through your EMR, or whatever it might be, of how those appointments are being confirmed, should really look at how can you adapt that message at this point that really emphasizes, again, more of just being empathetic to what those concerns are. So just again, creating a common understanding. And of course, new patients, again, there's certainly various options that are available for them. And we've talked some about telehealth as an example. Certainly, especially, as you kind of look at, the one question here about that maybe people want to wait a few months. Well, that's a good option for them for telehealth. Maybe that's more of a temporary solution. And even as part of your protocol in that telehealth visit, you really kind of set it up that way to say, it's really important that you receive the care that you need now. And then there's a protocol in place that, at the end of that visit, that there's an opportunity to schedule, or there's a mechanism in place to schedule that in-person visit right there. So that sort of sets the expectation. So again, as we've talked about here, and we look at, the operational side of things and then the communication part of it, what we're really trying to do now is what we're advocating, in this presentation is at the same time that we're being conscious of, providing quality care and doing things in the right way and the right pace, we do need to think about things from a business standpoint. And what are we doing now to kind of turn the dial, if you will, to more revenue producing types of communications. So in terms of, the building of that trust and confidence, and there's various examples of that, and this is a customer of ours. And what I want to kind of just communicate is that in their mind, they're in North Dakota, so not a lot of cases where they are. So they're really kind of in a position to be more forward, I guess, in the messaging but it's really, again, just this is a specific campaign just to reassure and build trust. And there's a lot of different aspects of this besides print advertising. There's a lot of things regarding digital and social media and all those good things. But, you may decide that you're going to do something like this, or even if you are rolling out, kind of new advertising campaigns and things like that, and not doing something like this, just to be very conscious of your language. And what I mean by that is just to always even more so have empathy, and to not, you want to make sure that, you find that balance between when you're marketing to prospective patients, that they're not looking at you as maybe being opportunistic in some way, okay, that you're still demonstrating that empathy. And so as you look at, these are some examples of some other organizations, there's different levels of messaging. And you can see here, though, I think that a common theme among these is education. Okay, there's nothing it's really providing them the education and the knowledge to make the best decision that's right for them. And I think by doing so, then again, that adds to that comfort level. And again, these are various parts of the country and different aspects of this, but this is from a print perspective. And you can see here, actually, this one in the middle, this is Syracuse Area Health. They're a customer of ours in Syracuse, Nebraska, and they're certainly using the opportunity to really be more assertive in their telehealth promotion as well. So just some things to kind of think about in terms of your messaging. And again, I guess the takeaway that I have on this is what we all do, what you all do in patient care. So it comes naturally, especially for those who are actually providers on the line here. It's the word empathy. It's that tone of empathy in your communications. It's the same way that you treat patients at the bedside as well. A couple other things here to just kind of think about that I think are some real kind of grassroots types of things that I think are very effective. Certainly different things in terms of just your communication you can do anything from letters to the community, various letters and communications to your patients, either organically or through your EMR, maybe special publications, newsletters, those types of things. Up to this point, a lot of our communication has been around educating people on COVID itself and things like testing, what to expect, when to come, when not to come, all those important things. And we've been really, especially as communicators, we've been focused a lot on those messages, what we're putting on our website, all those kinds of things. And now what I'm suggesting is we still do that, but we evolve now to really starting to help people understand that it's okay to move on. We still are going to be cautious as a society. There are things that we need to do. I think things have changed forever in terms, hopefully they have, in terms of, our protocol and what we do as individuals, but that healthcare, is needed, and that they do need to take actions in that regard. The example here, the video here, was done by one of our clients, and they did this independently of us, and I think they did an absolutely fabulous job. And you've probably seen various examples of this, but this is a very basic thing that you can do, and it's a combination of I can send you a link to this at some point if you're interested. I'm not able to show it on here, but that they have a couple of providers and they have an administrator who kind of have different perspectives, and it's just a very genuine type of message. It's not scripted. It's talking from the heart. And the thing like this is that it just has so many legs to it. It can be carried through, and as what we call a call to action, when someone responds to an advertisement, that they can click on this. But there's ways to just put this through social media and different channels in your community, and it just spreads like wildfire in a good way. Because generally too, that these people that are advocating these messages, particularly in rural communities, you most likely know these people, so that means a lot. So just a very powerful thing, something that you can do yourself. It doesn't, in fact, it's almost better. I mean, this was done very well, but it's almost better if it's not, Hollywood produced. You want it to just be natural. So anyway, and then there's other ways that, I think part of it is just that we're always listening as well, that we look at. And so there are ways that, we can hold kind of listening sessions, if you will, that we can even do online, virtual town halls, or as things open up a little bit more, maybe getting together in smaller groups and getting people's perceptions of what's happening. Kind of looking at, a lot of our organizations have patient advisory groups, which I think are really important. If those patient advisory groups are not gathering right now, to really be thinking about how to set those up virtually so that you're still receiving that input. I think that's really important. So, and then there's some of certainly the traditional types of things to help promote some of those messages, and a lot of the things that would come near and dear to you. But a couple of big takeaways that I would say, and I think it's especially how we're evolving as consumers in this post-COVID environment, is that there's more and more of an emphasis in terms of, among different demographics, varying demographics, of receiving their information digitally. Digitally can mean anything from what they read on a website to what they're searching, when they go on Google, what they're reading in emails and blogs. Those have a large impact and success, and also a way to really target a message that maybe some of the traditional ways don't always. There's always a reason and value in some of the traditional ones, but there's more and more of a trend more toward on the digital side. And I'll give you a couple examples of that here in a minute. But the last point I just want to make on this slide here is in regard to media relations. As organizations, you certainly have various relationships, with your newspapers and local radio stations and those types of things. But local media in particular are really hungry for the next part, the next phase. What are we doing? What are success stories? I mean, we've been focused a lot certainly on, how many cases we have in an organization and those types of things. But there's also some inspiring stories that can be shared. And as you know, in local communities, sometimes we don't even have the luxury of having reporters, but there are things that we can write in place and things like that. And I guess my point here is just not to underemphasize the importance that has in our local communities. So switching gears just a little bit, I don't know if I'd say switching gears, but evolving to this. So a lot of the conversation up to this point has been, COVID communications. What are we doing post-COVID to ensure that we have confidence and trust? And now, as I've advocated, it's okay, but we also need to be prepared to move beyond that. And what this does is, whether or not, as an organization, hopefully you've had some kind of a marketing plan. If you have, great. If you haven't, this is the time to do it. But even if you've had one, this is the perfect time now. You really do need to kind of reevaluate it and say, okay, just like even your organization's strategic plan, things have undoubtedly changed, or at least the timing has changed. So you have to kind of go back and re-examine that as well. And your marketing plan needs to certainly support what's in your strategic plan. So this is a time to kind of go back and say, well, let's reestablish our goals. And your goals were based on various revenue types of things, and that should still be in place. But you may also have some other goals that are regarding just community awareness and perception and those types of things as well. I mentioned before about some various ways in which we can listen to customers, and certainly focus groups are a good way, just in terms of different demographics, just to listen and to hear. And I'm a huge advocate of that, just to, if anything, just to affirm some things that you might be thinking as well. So, but again, as I've mentioned, I think now it's adjusting what we do from even to a more digital perspective, and that's where it does allow us to really measure some results that we have, and I think that's incredibly important. So in terms of measurement, we look at, as I kind of mentioned, in terms of your strategic plan. Certainly, a strong strategic plan is obviously broad in terms of its vision, but then it should also define specific measurable goals, or what we might call key performance indicators, or KPIs. And your marketing should fall in that same category. Generally, we look at it and say, as we're working with our customers, there's two types of marketing goals. There are business goals and communication goals. Those business goals are specific types of things, such as increase in patient volumes within a particular area, within a particular surgery area, for instance, number of procedures, overall revenue, maybe even more important in some ways is new patient acquisition numbers. Just different ways that we can have some measurable types of goals to see how we're moving the needle. And then there are communication goals, which are important, and they're oftentimes there's a correlation certainly with the business goals. And that can be anything from analytics of your website to interaction in social media, how many people attended a community education event, a lot of different ways. But those are important goals too, to assess overall if our message is resonating with people. So a few takeaways here that I want to discuss in just a slight more detail. And if anything, it's just really a reminder, and I talk a little bit about how it's a changing psyche of our consumer. So the first thing here is what we're marketing may have changed. So, and that's where I kind of said we go back and look at that strategic plan. But we say, some services might be more difficult to market than others. But the key takeaway for me on this one is how we talk to our audiences may have changed. And that's where I was kind of referring before when I talked about the empathy. We can't always maybe use the same messages because we don't want to appear insensitive, different feelings and worries that people might have. And of course, as I've kind of talked about, where we market may have changed. Certainly there's a role in traditional media, but I think in more and more, we're doing this, we're doing more webinars, right? We're doing a lot of conferences we're doing virtually. I think just generally as a society that, I still believe in good old fashioned face-to-face kinds of things, but there is a real value. And I think people are becoming more acclimated to doing some things virtually. And I think that also affects how we market to our consumers. So as a quick example of this, and these are just some digital examples, there's a customer of ours in Illinois and this is actually right before COVID, that was doing some very strong digital aspects to kind of get to these numbers. And now patients are coming back. I mean, now that patients are coming back, they're going to kind of resurrect some of those numbers. But again, this is kind of what you should expect from your marketing. I won't go into the details here, but just my message here is just to say that there are some very direct and strategic ways that you can increase surgery volumes, in particular, whether it's general surgery or specialty surgeries, by hyper targeting to key demographics of key needs that people have. And these are just some examples of how that was done in terms of the methods. But again, the takeaway that I want to have is just that you're considering that, yes, we need to be conscious of COVID, but yet we really can and should be focused on how we can build our business. This is an example of the communications objectives as well, and just some overall volumes that doing the right way that you can expect. So I'm going to hand it back to Lori here in just a second, but my point here is just that it is time to cast your line. It's time to move on with, cautiously, certainly taking into effect the various operational things to make sure that we're prepared and that we're ready. But then as we roll that out, we just need to make sure that our patients are ready. And if they're not quite ready, to communicate in an empathetic way to get them to feel more that way.
Right. So in summary, we've talked a lot about planning, all the steps and things that we need to be thinking about as we plan to start opening up for elective cases again, considering your backlog of cases, scheduling, registration, infection control processes, all those things that we need to be thinking about. Mike talked about calming the waters, how we need to give you lots of great ideas about building confidence internally and with your new and existing patients. And then the time is now. Just start adjusting your marketing plan. Talked a lot about, gave some great ideas about marketing plans and setting service line priorities and shifting from COVID-19 communications to revenue generating marketing.
All right. Well, thanks, Lori. It was fun.
Yeah, great. Thanks everybody for attending and have a great rest of your day.
Great. Thanks, everybody. If you have questions, we have our information here on the screen as well. Take care, everyone. Thank you.